Research has always been at the heart of the NHS, and that's how we've led to new innovation and new discovery in the health service. We want Bradford to be one of the leading centres for health research, not just in the country but internationally. We want to be a large hadron collider for health research.
Bradford has solidified its position as a leader in world-class people-powered medical research, achieving the highest number of volunteers for health studies in the UK over the past year. The Bradford Institute for Health Research has recruited over 25,000 local volunteers for 86 live studies, claiming the top spot for volunteers nationally for the first time. This week, Professor John Wright, Director of the Institute, shares insights from Bradford's transformation from a neglected backwater of medical research into a global leader in the field.
So my name's John Wright. I'm the Director of Research for the Bradford Institute for Health Research, which covers Bradford and Airedale. Back in the noughties, we became a teaching hospital here. For a new teaching hospital, we had so little research going on. In a city, one of the biggest cities in the UK, we had the lowest healthy life expectancy, highest rates of diabetes. So you had this paradox of high levels of ill health, but very low levels of medical research. We have an aging population with complex, multifaceted needs. We have a young population with some of the worst mental health that we've ever seen. One of the biggest problems we face is the high levels of inequalities, particularly in this country. But on the background, we have unregulated social media, which is really affecting the mental health of our young people. And we have, further down the line, climate change, which is going to be the biggest global health challenge in the future. We need to find new drugs, new vaccines, new ways of preventing disease, and better ways of redesigning our services. We wanted to do something different from the traditional teaching hospital model that we saw in Manchester or Sheffield or Leeds or Newcastle. They had developed these big centres for molecular research or genetic research. We wanted to do something which was much more people-powered. And so we reached out to our community to find out what their priorities are. We reached out to our collaborations across Bradford and Airedale, across primary care, across the care trust and mental health, and also importantly, not just relying on one university, but relying on the best expertise from around the country to come and help us. And that's people-powered collaboration has paid off hugely over the last few years. The big challenge in research is how do you get people engaged? How do you tell them this is something that's going to be of value to you? Research has always been at the heart of the NHS, and that's how we've led to new innovation and new discovery in the health service. When you've got a disease like asthma or diabetes, you can see the personal link. That's why you want to get involved in clinical trials to get better treatments. But there's other opportunities as well for our aging population. How do they prevent ill health as they grow older? For our pregnant population, for new mums and dads, they want something best for their children. That's a really important time, and that's one of the big triggers for Born in Bradford. We have about 300 researchers in the centre, covering everything from older people, children, patient safety, quality improvement, data analytics, AI, and clinical trials. When you look at the results of what we've been doing over the last 15, 16 years, you can see the impact just about everywhere. Developing clean air zones to improve the air quality, developing new green space because we know that's good for mental health. We've got new ways of embedding computerized assessments for older people. We've got ways of improving patient safety on our wards, not just in the city, but nationally and internationally. There's another unintended consequence of what we're doing, which is also pride in place, pride in the city. We want Bradford to be one of the leading centres for health research, not just in the country, but internationally. We want to be a large hadron collider for health research, but we want to do it with a strong patient community voice in everything that we want to do. When you look at our recruitment across the city, It's everywhere. It's in GP practices, it's in outpatients, it's on the wards, it's in maternity, mosques and to churches, into schools. We have a big teenage study, one of the biggest in the country at the moment, Age of Wonder, which touches just about every secondary school in the district. So our research is really focused on improving people's lives in Bradford, but more importantly, it's about how we can use this as a model to change the world.